just going to step to the side so we can all see. And as I want to let Brother Al read a little something for us. And this is a little bit about our history of MOCHA.
Thank you. Thank you for this opportunity. The Dbn, we thank you for reaching out to us and letting us be a part of this great award to all those before us. And we are definitely men of color, health awareness in the MOCHA. We've been around. It started in this little room down at the Y with several other people who was looking at the disparities in our community, that black men were dying quickly, and why we could find a way to help them become better men in the community. So James Morton and Dr. Sanford from the University of Massachusetts all got together and thought of a cohort, which kicked it all off about 2008, 2010. We got a grant from the Department of Public Health that helped us to develop our curriculum and to be able to go out in our community. And we have touched over about 500 men in our community, and we have graduated about 300 under the first cohort, which was with the Department of Public Health. Then the University of Massachusetts come along with the National Institute of Health and Health Disparities that has allowed us to have more money so that we can be more of a vehicle of this movement out in our community to help men, to make them to understand that we are needed in our community. We don't want to just die. We want to be a voice in the wilderness, crying out to make the pathway straight for the young men that's coming behind us. So we're just grateful, and we're going to let our coordinator come up, and he wants to say a few words.
Hello, good evening to everyone. Thank you for having us. Thank you, Gina. Thank you, Dbn family. I'm very proud to be the director of MOCHA, Men of Color Health Awareness. They've been doing great work since 2010, even beyond before that. The thought and the concept is we're trying to be as good as you lovely ladies out there, because it's the ladies that push the men to go to the doctors. So we're trying to get as strong as you and get the brothers to push the brothers to the doctors, because we know that we all are the pillars of our community. And I thank you for supporting us, and I thank you for your continued support and prayers. So that's all I have to say. I'm going to give the mic to the man who definitely has a few more words to say, Mr. Lamasca.
Thank you again. I'm the outreach coordinator, and also I'm the assistant director of MOCHA. Just give you a little history of us. MOCHA is the Men of Color Health and Awareness. We're a brotherhood of working men to promote the health and wellness of the men and their families in our communities. MOCHA provides a safe place, space, and bond to support each other and organize for social justice. We hope to enable men to learn strategies to improve the mental and emotional health while engaging in the chronic disease of self-management and wellness activities throughout peer-led activities. We also look at MOCHA in the future. We cannot help but to, from peer and looking into the rearview mirror of MOCHA's past, James Morton, as both said, Brother Al, and also CEO, and also the YMCA, who allowed us the first opportunity to put this program into action. Now, which is no longer a program, it's a movement, because our plans are to start from Springfield and take this across the country. Okay? As we allow ourselves on this mission, we're finding ways to close the health disparities in that gap with men of color in Springfield and the surrounding area. With grants that we secure from the Massachusetts Department of Public Health, National Institute for Minority Research, also University of Massachusetts, and other grants that we are seeking for, we realize that MOCHA is a dream, and we realize that MOCHA also emerged from moving fast forward from 7 to 8 to 9 years ago, where MOCHA is today. We're still doing the same work in our community to focus on men of color and support our needs. We ask men, it's a funny thing, we had a group Saturday, and we was out to recruit only maybe 40 men, and we pulled off almost 75 men to come in that's ready to engage. And we also had an opportunity to put in another 250 men throughout the year to be part of this. So we're encouraging the women, the mothers, especially the men, to please be a part of this organization and this movement. It's so important to us. Without your involvement, it's hard to get funding, and we also appreciate the City of Springfield, Department of Health, and everyone that does the community work for our community. I want to say thank you, and from all of us, bless you. Thank you again.